on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Ansaar will be held responsible for any ill health caused by the advice given on Radio Ansaar.
أحب الوفاء بشتى الصور أحب الوفي الأمين الأغر فأهل الوفاء كلون السحاب وحسن الربيع والماء المطر أحب الوفاء بشتى الصور أحب الوفي.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على رسوله الكريم سيدنا محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. All praise due to Allah, the Lord, cherisher, nourisher, sustainer and master of the universe, the most gracious, the most beneficent, the most merciful. Ya Allah, it is only you that we worship and is your guidance that we seek. Ya Allah, keep us in the straight path. Ya Allah, show us your choice of blessings. Ya Allah, show us your mercy. Ya Allah, guide us. Greetings, salam, salutations on our beloved Nabi Muhammad Rasulullah sallallahu alaihi wasallam. Welcome to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. Assalamu alaikum wa rahmatullahi wa barakatuh. And we welcome our listeners on Radio Ansaar, CII Radio, Voice of the Cape, Radio 786, Sirius FM, Radio Islam, IFM Port Elizabeth, and all listening to us on audio streaming and other platforms. Our topic for discussion this evening is heart disease in children, and our very special guest is Dr. EBRAHIM HOOSEN, a pediatric cardiologist. Dr. HOOSEN, Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah khair for joining me in the program this evening.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you very much for having me.
Absolute pleasure, Ibrahim. Now, I introduced you as a pediatric cardiologist. Tell us, what is a pediatric cardiologist? What are your functions?
So, pediatric cardiologist is basically a pediatrician, so someone who deals with children and then who narrows down further and just deals with children with heart problems. So, children born with heart problems and those who get heart problems later on.
So, children also get heart problems. So, what sort of heart problems do they get?
Yeah, so, looking at the type of patients I get, number of groups. We'll start with common ones are newborns. So we see a fair number of newborns with heart problems, and these are generally what we call congenital heart problems. So problems that someone is born with, that you, when you're born, you have that problem. How they present to us, so we get some that are diagnosed what we call antenatally. So they, the mom finds out she's pregnant, she goes to obstetrician, they do a fetal scan, and sometimes they're able to pick up that there is some sort of heart problem, and so they will refer that patient to be delivered at a center where they can deal with that heart problem. And so the baby is born knowing or suspecting that there is a heart problem. Others are picked up after birth, so there may be certain things that would worry the doctor that there may be a heart problem. We can talk about that. So some are picked up at that stage, and then later on others may be picked up at various stages in childhood, sometimes later. So those are the congenital heart problems that newborns, some are picked up in newborn period, some are picked up later depending on the type. We can talk about how they're picked up. And then you get another group where you're born, your heart is normal when you're born, but you may develop heart problems later on, like most adults. Most adults, you get as you get older, depending on how your lifestyle and this and that, then you get your blood vessels get clogged, and then you get a heart attack, and that's an acquired heart problem. So ischemic, what we call ischemic heart disease, is acquired heart problem. In children, you can get acquired heart problems as well that you're not born with. So you may get a problem with your valves, what we call rheumatic heart disease, which is still very prevalent in South Africa. You may get weakening of the heart muscle, something we call cardiomyopathy. That can happen when you get a few other what we call acquired heart problems. By far, most of the problems we see are congenital problems. So how we pick them up, as you said, the the one group is picked up antenatally.
Mhm.
The other group is where the pediatrician who looks after the baby after the baby is born may suspect there's a problem. There's certain things that may suspect that there is a problem. The amount of oxygen. So most babies now should routinely have their oxygen checked as part of their normal neonatal examination.
Mhm.
They would check what we call the saturation, the amount of oxygen in the blood, in the hand and in the leg. And if it's low or there's discrepancy, then the pediatrician may suspect there's a heart problem and refer that patient, or the patient you may notice that the oxygen is very low and that patient will be referred fairly urgently, or they may pick up other signs
Mhm.
that there is a problem.
Now, what sort of other signs they can pick up? I mean, will the baby present with any symptoms?
Yeah, so initially, as we said, the baby may become very blue. That's what we call cyanotic congenital heart disease. The parent may realize that, the baby cries, the baby gets very blue. And that may be one instant that they would pick it up. When the doctor examines the child, they may pick up what we call a murmur. So a murmur is an extra sound of blood moving rapidly through the heart, and that may alert the doctor that there's a heart problem, and the doctor may then refer for a pediatric cardiac assessment. Other things may be picked up a bit later. So you might you may find the child's not growing as well as he should. They have a growth chart, and the child's growth is not keeping up to that. In time, the baby may be breathing a bit faster and having difficulty breathing, especially when the baby is drinking milk, becomes tired. When drinking milk, can't finish their feeds, they become tired. That may alert the healthcare provider that there is a problem. The child may get frequent infections, chest infections all the time, and sometimes that's when they present to us or they realize there's a problem. Again, as I mentioned, some patients may seem to be okay, but when the doctor examines them, at the normal visit, he again picks up abnormal heart sounds and then refers them as well. So there are a number of opportunities there are, and if the baby is being monitored as he normally should be, then these heart problems should be picked up at some stage.
So, when a baby is referred to you, what sort of tests would you be doing to determine, what the condition of the baby?
Yes, so usually we start with the normal, examination that your doctor normally does. We do that as well. The other test that we may look at is a chest X-ray, and again, the pediatrician or referring doctor sometimes is alerted to the fact that there may be a heart problem when they do a chest X-ray and they see the heart is big, or the lungs look abnormal, or the shape of the heart looks abnormal. So chest X-ray. Then we do what's called a electrocardiogram as well, and that can sometimes, if it's abnormal, help us decide what type of heart problem or whether there is a heart problem. And what we do to diagnose most congenital heart problems is an echocardiogram. So an echocardiogram is basically ultrasound of the heart, and that helps us make a fairly accurate diagnosis of practically all congenital heart problems. Depending on the diagnosis, there are other tests and evaluations that you can do that are more specialized as you need them.
Now, what's the prognosis like? I mean, you got a baby, he or she's got that congenital heart problems, as you say. What's the long-term prognosis like?
Yeah, so that's important. That is also, of course, something that every parent wants to know. A lot will depend on the type of heart problem. So some heart problems are fairly simple and fairly easy to treat. So there will be just one problem.
Okay.
A narrowing of the valve, a hole in the, what they normally call a simple hole in the heart. It may be, a valve that's leaking a little bit or something, just one problem. A lot of these problems are minor. So a small hole, for example, a little bit of narrowing of a valve, a little bit of a leak of the valve doesn't need anything done. So there may be a good percentage of patients would have a heart problem. I would say close to half to 2/3 that would have a heart problem, but there would be a minor problem that don't actually need anything done. Some of them may need just to need to be monitored for a period of
In
time.
fact, there's a question that's come through exactly on what you're speaking. Assalamu alaikum. What about walaikum salam wa rahmatullahi wa barakatuh. What about a baby born with a hole in the heart and the hole does not close and requires surgery?
Yes. So again, hole in the heart is a sort of generic term. So there's a hole. We need to know where that hole is. So you've got 4 chambers in the heart. It can be between the lower 2 chambers. It can be between the upper 2 chambers. It can be between the connection between the pipes that send blood to the lungs and the pipe that sends blood to the body. So it depends where the hole is. So second, you have to know the size of the hole and what the problems that hole is causing. So sometimes you have a fairly small hole. It's not causing any problems. And those we may just watch. Even with a small hole, depending on where it is, we do have to watch these patients because sometimes it can cause problems with adjacent valves, other structures. Babies with congenital heart disease, even if you don't need to operate or they don't have other problems, they are at risk of infection in the heart. So you can get something called infective endocarditis, where if there are germs in the blood, they may cause because the blood is flowing fast to the heart, it sometimes scrapes out a little bit of the lining of the heart, and that predisposes them to infection within the heart. So they may be at risk of that. So we may just need to follow them up if the heart problem isn't causing or going to cause any problems. However, if the hole is big, if it's causing problems or may cause problems, so where you've got a big hole that's causing too much blood to go to one side of the heart and too little to the other, and the patient's not growing well, getting frequent infections, getting sick all the time, then certainly that has to be considered for closure. And always you have to look at the benefits versus risk of any procedure. And if the benefits are far more than the risk, then certainly those patients, it will be recommended that they have something done for that.
The question continues and says that, and the hole does not close and requires surgery. So I think you've dealt with that.
So if it requires surgery, then the doctor will then tell you these are the risks, these are the benefits, and the benefits usually would outweigh the risk before considering surgery.
060-904-1056. If you have any questions on heart disease in children, we have in the studio with us Dr. EBRAHIM HOOSEN, a pediatric cardiologist, and he'll gladly answer your questions on heart diseases in children. 060-904-1056. You may send us a WhatsApp and we'll attempt to, Dr. HOOSEN will attempt to answer that question, inshallah. Now, you did tell us what tests can be done to diagnose a heart problem, but how rife is this? How rife is a heart problem among children?
So it's actually quite common. It's one of the most common, what we call congenital abnormalities, so problems that someone is born with. So, you may have problems with the brain, the abdomen, lots of parts of the body, but heart problems are, interestingly, one of the most common. And it's close to 1 out of 100 children are born with some sort of heart problem. Of those, about just over 1/3 actually would need some sort of procedure or operation done for them in the first year or so of life. Some of them may need procedures or something done later, but a lot of them may not need anything done. So a significant number may have a heart problem. It's usually minor. They often can just be monitored and don't actually need any sort of procedure done. So a lot depends on the type of heart problem. And you can have 5 people can have the same hole in the heart, but the management may be completely different. Just depends on how big it is, where it is, and what problems it's causing.
Question comes from Sister Leila, says, Assalamu alaikum. My 8-year-old daughter has always had a very fast heart rate, even at rest. Is this serious and something to be concerned about?
Yes, so a fast heart rate can be it can be relative. So we need to know how fast and, is it normal fast or abnormal fast? So I say normal fast is that all of us under certain circumstances, are going to have a fast heartbeat.
Yes.
So if you're running, okay, your heartbeat will be fast. If you're frightened or excited, your heartbeat will be faster, will become fast. So that's an appropriate fast heartbeat. Children's heartbeats tend to be faster than adults. But whether it's appropriate or not depends on a few things, on the rate, number one. And in some people, they may have what we call rhythm problems. So a rhythm problem is where, everyone's heart has a system. We have a system that, it's called the autonomic nervous system, if I could put it. So it's a system in your body that regulates everything down. So you don't remember, I need to take a breath now. I don't think, you don't tell your heart, it needs to beat so fast or so slow. So we have a system that controls your blood pressure, controls your breathing, controls whether you're sweating or not, everything. Okay, and it controls your heart rate as well. And so your heart gets a signal that tells it, to beat at a certain rate. And this signal goes from the top part of your heart to the bottom part of the heart. And there are specific pathways, if I could put it. And it's like an electrical signal that tells you your heart, the top part of the heart start beating, the signal goes to the bottom part of the heart and it starts beating. Sometimes things can go wrong with this signaling system. And when something goes wrong with it, you may get what we call arrhythmias, or rhythm problems. So that's another type of heart problem, which I didn't mention earlier. And it's good that it came up now. So rhythm problems can occur, and that can be either because somewhere in the heart fires at the wrong time and causes your heartbeat to be fast, or you may have an abnormal channel or pathway in the heart that causes sort of short circuit to occur and for your heart to beat fast at certain times. So, a fast heartbeat, it just depends on the circumstances and the cause. If there's a worry that there's a rhythm problem, then it would be important to get an ECG at the time that the heart is beating fast. And then we can see whether this is an appropriate response or inappropriate response. That can be quite tricky. So if it's something that happens, for 10, 15, 20 minutes, and the person says they can feel their heart beating fast, someone measured it, it really is beating fast, maybe they're feeling a bit dizzy or they faint because of it, and then we're able to get them to a doctor and do an ECG, what we call an ECG, which is electrocardiogram, and that measures the electrical impulses or the electrical signals in the heart, and that will give us an answer whether this is a rhythm problem or not. Sometimes it doesn't last for very long. It's a short period of time. It can be difficult to get to an ECG while this is happening. Then there are other methods to do this. A patient can have a 24 or 48 hour ECG that's put on them and kept on them. And if it happens within that period of time, then we can record it. Or there are other ways that you can record it for much longer. But a lot depends, of course, on a good, history, speaking to the patient, getting a very good idea of how this occurs, when it occurs. And if it's worrying, then we could, take it further and investigate it further. A lot of the time, a fast heart rate is appropriate. So, someone's running, someone's excited, and the heart rate is fast. And sometimes, when someone's, some children are very thin, then they may even notice that the heart is beating fast. They may even complain that the heart is beating fast. But if it's an appropriate response due to the activity and so on, then that usually isn't a concern.
Jazakallah khair. For the 060-904-1056, we're discussing heart disease in children. And in the studio, we have with us Dr. Ibrahim Hoosen, a pediatric cardiologist. Now, Dr. Hoosen, the question that comes through says, Salams, my brother and the doctor. Wa alaikum salam wa rahmatullah. What is the difference between an adult and children's heart condition?
Yes, so adults can also get congenital heart problems. So sometimes we find, people are born with heart problems and no one picks it up in childhood. And sometimes people get picked up when they're 20, 30, 40, sometimes even 50 or 60, certain ones can be picked up. So adults certainly can be born with heart problems that are picked up later. Most adults, though, their heart problem is due to what we call ischemic heart disease. So that is because with age, okay, and your lifestyle. So, if you've been eating all the good food and you haven't been exercising adequately and, the rest of it, or you got your genetics are such that you're more prone to what we call atherosclerosis. In time, your arteries that supply your heart and other parts of your body, develop plaques and start becoming blocked. And so if they become blocked enough, you're then prone to the blood supply to the heart may be affected. If it's blocked completely, it may cause part of your heart to not get blood, and that's the typical heart attack. Or you may get less blood and you may start getting pain when you're walking and so on. So that's the typical adult type of heart problem, or the most common, I should say, heart problem. The other heart problems that adults can get, as you said, they can get rhythm problems. They may get, weakening of the heart muscle with time and so on. So there are other heart problems that they can get as well. But most adults, the problem is what we call ischemic heart disease, where the blood vessels supplying the heart muscle start to become old and become blocked. In children, as we said, the most common is something you're born with.
Yes.
And it can, it doesn't mean that if it's there for life, obviously. If you're born with something, it may be treated if necessary, but it will continue. That problem will continue into adulthood.
Jazakallah khair. We're going to take an ad break. On the other side of this, we'll continue with the show. We are discussing heart disease in children. Our guest is Dr. Ibrahim Hoosen, a pediatric cardiologist. And if you have any questions, you may forward them to us via WhatsApp on 060-904-1056.
Teaching you something new every day. Radio Al-Ansar.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickfield Road, Overport. Simplex Radio, the name you can trust.
There are over 200 million orphans globally. We can't help all of them, but what if we each helped just one? The Al Imdad Foundation now gives you an opportunity to help just one orphan from Syria or Palestine. For just 500 Rand per month, you can help safeguard the dignity of an orphan by assisting them with basic needs such as food, clothing, shelter, medical care, and attention. Our orphan sponsorship program allows you to track the progress of your orphan through regular feedback. Make a difference in the life of an orphan today. Visit alimdad.com or call 0861 786 243 for more information.
It's official. Checkers Foods Kawi Park is our first food store with a halal butchery, bakery and deli certified by NIHT, the National Independent Halal Trust. This will ensure high standards and ethical practices across our butchery, bakery and deli from farm to table. So visit Checkers Foods Kawi Park for an exceptional shopping experience that keeps getting better and better.
Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al-Ansar will be held responsible for any ill health caused by the advice given on Radio Al-Ansar.
WhatsApp us now on 060 904 1056.
أحب الوفاء بشتى الصور.
Medical Files brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. Our topic for discussion, heart disease in children, and our special guest is Dr. Ibrahim Hoosen, a pediatric cardiologist. 060-904-1056. Any questions for Dr. Hoosen, please forward them to us via WhatsApp on 060-904-1056. And Dr. Hoosen, tell me, what causes a child to be born with a heart problem? What can be some of the causes?
Yeah, so, the heart is formed within the first 8 to 12 weeks gestation. So once you fall pregnant, before the first 3 months, the heart is already formed. And if there's going to be a heart problem, often you already know at that stage that there's going to be a heart problem or not. So what are the things that cause it? There are two. A lot of these patients are what we call multifactorial. So there may be more than one factor. One factor is genetics.
Okay.
So it can be something in your genes. It can run in families. So if a parent has a heart problem, then your chances of a child having a heart problem goes up. If you have certain what we call, if a baby has certain what we call genetic syndromes. So they have, for example, Down syndrome. If they get something Down syndrome, and there are many reasons that you can get a baby Down syndrome, then the chances of a heart problem are about 50%. Half of them would have problem.
Okay.
And so there are other similar genetic problems that predispose a child to heart problem. So one is genetic and the other one is what we call environmental. So things that happen within the first trimester the first trimester is the first 3 months.
Yeah.
So what are some things that can happen there that can cause abnormality, cardiac or other congenital abnormalities. Important things are anything that the mother takes. Okay. So obvious thing is alcohol. Alcohol can cause a whole lot of fetal problems, including cardiac problems. The other thing is any medication that you take. So you have to be very careful about what medication you take. And certain medication have to be absolutely avoided in pregnancy, particularly early in pregnancy. So things like acne medication. So people take Roaccutane or for acne, for example. And they have to be very cautious, and if the doctor prescribing needs to ensure that they do not fall pregnant when taking Roaccutane. They can have serious congenital problems, including cardiac problems.
Okay.
So you have to be very careful about what sort of medication or any sort of thing that you are taking, particularly early in pregnancy. So that's one. The second is infection. So certain infections we know are prone or predispose people to congenital problems, including cardiac problems. And that would be rubella is the classic one. So rubella or German measles. So that's why, in school it would be the girls particularly who would get vaccinated against German measles. I don't think they do it anymore.
I'm not sure. Yeah.
But specifically because if you get German measles in pregnancy, it can cause serious problems and other infections as well. Even a common flu can predispose you to problems. Other things are maternal illness. So a mother who's diabetic, for example, if your diabetes is poorly controlled in the first trimester, then that predisposes you again to congenital problems, including congenital heart problems. So those are so-called environmental factors which you can control. And then, of course, genetic factors are usually much more difficult to actually control. Nutrition is also important. So we know that certain things predispose you to congenital abnormalities. So folate deficiency, folic acid, which is one of the vitamins that predisposes you to not only cardiac but other problems as well. So again, adequate nutrition, avoiding exposure to toxins, making sure that you don't have any uncontrolled conditions like diabetes, are all things that someone can do to prevent heart problems. But of course, in a large proportion of patients, you can do everything right, but there's still a risk.
Yeah, it's meant to be. It's meant to be. In fact, I was going to ask you about preventative measures. What preventative measures a mother can take?
Yes.
You seem to have covered most of it.
Yes.
Yeah. Okay, there's a question that's come again from Sister Rashida. Said, is it possible that children can have bypass surgery?
Yes. So we talk about how we manage congenital heart disease. So as we said, a certain proportion of children with heart problems are going to need some sort of procedure to manage it, for them to lead a normal or near to normal life. So some heart problems are what we call, you can correct it. You can do one operation, that's the end of it, they correct it. And that's the best. Others, unfortunately, are more complicated. They may need more than one operation. They may need more than one procedure. Some procedures can be done without an operation. So, certain small, narrowings of the valves or certain holes or pipes can be closed without a open bypass operation. They can have a procedure that's done. As you know, the adult cardiologist will put in a catheter and do dilate the coronary arteries or put a stent and so on. In a similar manner, valves can be dilated or small holes can be closed with what you call a cardiac catheterization. So a small catheter that's threaded through the heart vessels and then deals with the area, deals with the problem where it occurs. If that isn't possible, or then open heart surgery can be done, certainly. And it can be done even in the neonatal period for certain heart problems. So neonates, older children can certainly undergo bypass surgery. It's become almost routine for certain problems and it can be done with high rates of success for most problems. Fortunately, a lot of the problems where there's a hole in the heart, a simple hole in the heart, one operation and usually these children can lead a normal life. Of course, more complex problems, you may be able to help them to grow up, but they may need more care and more procedures later on.
Now, a child is born normal and then a child acquires a heart problem. What causes the child to acquire a heart problem after birth?
Okay, so we talked about congenital, the one you're born with, and then we talk about acquired heart disease, much less common nowadays than what we call congenital heart problems. So congenital for us, 90% of what we see is congenital. The acquired heart problems, one is where the heart muscle becomes weak, what we call cardiomyopathy. That can occur in adults as well. And it's pretty common in older adults for a number of reasons, but it can occur in children as well. There are a number of reasons that you can get what we call cardiomyopathy. One is certain people, when they get a viral infection, so they get a flu or a cold, their body reacts in a certain way and it can affect the heart muscle and cause what we call myocarditis, inflammation of the heart muscle. So this can cause the heart muscle to be weak and cause them to get signs of what we call cardiac failure. They become tired, they breathe fast, they lose their appetite, their legs may swell up and so on. They may get signs of heart failure. So that's one is what we call myocarditis. And some of these patients may get better with time. Some, unfortunately, may not get better and may need to be on long-term treatment and have other issues with that. So that's one. So myocarditis. Others may have cardiomyopathy for other reasons. Again, you may have genetic cardiomyopathies. So you're born with a predisposition to get a weak heart. And there are certain ones that are what we call genetic. That's true. And there are other acquired heart problems as well. So one is what we call rheumatic fever and rheumatic heart disease. And this is related to infection, which you may get. It's a certain germ which usually causes a sore throat. And in certain people who have a predisposition, it may affect the valves of the heart and cause what we call leaking valves. So they may have leaking valves. This may be mild. It may be severe. Some of them may need surgery for this. Others may recover. So those are some of the acquired heart problems. There are others as well that can affect the coronary arteries, the arteries that supply the heart, similar to how adults get heart attacks. Children can get abnormalities of the coronary arteries, usually following a type of condition, what we call an immune condition, so it affects the certain vessels of the body. It's like you get adults with autoimmune disease like rheumatoid arthritis. So those are autoimmune disease. You can get an immune disease in children called Kawasaki disease, which can affect the blood vessels. And that can, again, is acquired problem which can occur in children. So those are some of the acquired that you can get, not born with, but get later. But as I said, they tend to be far less common than the congenital problems that we see.
060-904-1056. We are discussing heart disease in children, and our special guest is Dr. Ibrahim Hoosen, a pediatric cardiologist, and he'll answer your questions on 060-904-1056. Now, Dr. Hoosen, are there any steps that parents can take to reduce the risk of heart disease in the children?
Yes, so we mentioned, of course, congenital heart disease. That would be the things that you do in the first trimester. But as I said, you can make sure you eat the right food. You can avoid any toxins or drugs that may predispose you to heart problems. You make sure you don't take any. You're very careful about the medication you take. If you have any chronic problems, you make sure they're treated well, and so on. So that's the one thing that you can do. The other, of course, important thing is that what you do in childhood has implications for adulthood.
Okay.
So good habits that start in childhood can prevent you getting your heart attack at 40 or 50 or 60. So again, lifestyle choices that we make and the type of lifestyle we lead in childhood affects us in adulthood as well. So the important things, of course, is diet and healthy diet, and again, exercise. So it's a big problem now that a lot of children are becoming obese. Okay, becoming obese mainly because one of inactivity and type of diet. So if you're having cold drink every day and burgers and chips and that sort of thing, and you're sitting and playing on your telephone or playing video games the whole day, then that predisposes you to weight gain, and that will again accelerate the risks of diabetes. And we're seeing teenagers getting diabetes now due to overweight. It increases the strain on your heart. You can get the heart muscle becoming thicker early, and again it increases your risk of early heart problems and so-called ischemic heart disease. So again, good habits, adequate physical activity. So children should have at least 30 minutes to 1 hour of reasonably vigorous physical activity every day. They shouldn't be sitting for hours on end in front of a screen, watching television, or being inactive. They must have a good amount of activity a day. And as we said, a good diet. So physical activity, good diet, and avoiding what we call a sedentary lifestyle is important. And of course, the other habits, vaping, smoking, are major risk factors for ischemic heart disease.
Thank you, Dr. Ibrahim Hoosen. We're going to take a quick ad break. We'll continue on the other side of this. Just remember, if you have any questions for Dr. Ibrahim Hoosen, 060-904-1056.
Station for information, Radio Al-Ansar.
Craving for an easy, spicy and delicious meal made in minutes? Introducing Easy Mee Goreng, Korean-style instant noodles from Noodle King. This delicious, flavorful noodles is ready in minutes with a kick in every bite. Get your pack of Easy Mee Goreng at a retail store near you. Noodle King also boasts a whole variety of other delicious pantry must-haves. Look out for our brands at your favorite retail stores. Get ready to elevate your fitness game at First Fitness in Durban's Berea. With a spacious free weight area, award-winning equipment, and exclusive ladies-only parking and training level, we've got everything you need to crush your goals. Hit the ground running on our outdoor track or unleash your inner warrior in our MMA and boxing dungeon. Plus, enjoy high security and ample parking. And don't forget to refuel at our Halal Coffee and Health restaurant for the best in coffees, smoothies, and healthy eats. Join us today and redefine your fitness journey. First Fitness, dare to be extraordinary.
Butterlicious, butterlicious, butterlicious. When the food melts in my mouth, so does my heart. Blended by our expert chefs with pure cotton seed oil. Divine lasts longer, so cook more with Divine. Divine makes every meal a special treat. It is Butterlicious. Approved as part of the Heart and Stroke Foundation Eating Plan, Cotton Mark SA, and a proudly South African product. Divine Cooking Oil. Butterlicious.
Saturday, 11th of October 2025. You, your family, and everyone you know have a date with the Breakfast Rush team and everyone at Radio Al-Ansar. What will you be doing? Well, walking, running, socializing, and so much more. Online registrations are now open on our website, alansar.org.za. If I can make it to this event all the way from Johannesburg, so can you.
Your perfect companion, Radio Al-Ansar.
أحب الوفاء بشتى الصور.
You're listening to Medical Files, brought to you by the Islamic Medical Association of South Africa, hosted by myself, Faizal MJ Suleman. Our topic for discussion is heart disease in children. Our special guest this evening is Dr. EBRAHIM HOOSEN, a pediatric cardiologist. And if you have any questions on heart disease in children for Dr. EBRAHIM HOOSEN, you may forward them to us via WhatsApp on 060-904-1056. So, Dr. Hoosen, thus far we've spoken about the causes, we've spoken about symptoms, we've spoken about prevention. Is there any advances, in technology or any? What are the recent sort of advances in treatment?
Yeah, okay. That's. I think it's important to look at the history as well. So if you were born 40 or 50 years ago, and you had a heart problem, there's very little anyone could do. They wouldn't even know you had a heart problem.
Yep.
So the first operation was in about 1938, 1940, for a very simple heart problem. And it's only in the last 20, 30 years that we've been able to treat most heart problems. And there have been lots of advances in that time, in terms of cardiopulmonary bypass and a lot of the other interventions that we can do. So some of the more recent advances, one is fetal surgery. So certain heart conditions, that may be fatal or may have serious problems, they're now looking at treating them in the fetus. So before the baby is born, actually, if there's a valve that's narrow, and early on, if the valve stays narrow, then the heart and the blood vessels that it feeds may not grow. But if you can treat it in the fetus, then it allows it to grow and makes the heart problem less serious. So fetal interventions are one thing that's fairly new, still very experimental, still very difficult, but certainly one of the new frontiers in management of cardiac lesions.
It must be very delicate and
extremely
high risk as well.
Extremely delicate, extremely high risk. And these patients have to be very carefully selected. There are certain centers that specialize in this sort of thing, but that's certainly one of the new frontiers that they're looking at. So fetal interventions.
Has this developed internationally?
There are certain centers that are doing it. I must say in South Africa, it isn't something that's commonly or done practically at all. If it is done, it's for very minor sort of conditions, but it's done in a few centers internationally, and again, something that's highly specialized. And again, as you said, of high risk as well. Other things, there have been lots of advances made in managing these patients without surgery. So what we call catheter interventions, and a fair number of lesions can be closed in the without surgery. So holes in the upper chambers of the heart, some holes in the lower chambers of the heart. Extra pipes can be closed without an operation. So usually it's a day procedure. They can come in the day before, have the procedure done, and go home the next day. So it's within 24 hours they're gone. So that means similar to how adults have stents, and that a lot of procedures in children can be done that way. And then even for a lot of the more complicated heart problems, where they're very complex heart problems, where instead of 2 chambers or 4 chambers in the heart, there may be just 3 chambers, and you can't really completely fix the heart. But there are techniques where you can do procedures that sometimes are fairly complex, but may help these children to have a fairly normal childhood and survive for a number of decades. So even for very complex heart problems, in many of these children, there may be procedures that have been developed to manage even the most complex heart problems.
Now let us look at children who have these. Let's talk about these heart diseases, be it congenital, be it acquired. Now, are they going to live a normal lifestyle, playing soccer with their friends and running around, etc., etc.?
So again, that's important thing, because we're now seeing a new group of patients. So children who have either treated or sometimes untreated heart disease, who are becoming adults. Because if you've had a congenital heart problem, whatever you had done to you, it continues into adults. And now we're seeing a growing group of what we call adult congenital heart disease, or grown up. They used to call it GUCH, grown up congenital heart disease. So children, a lot of children who've had the heart problems attended to in childhood, but of course may have ongoing problems in adulthood. So some problems, of course, you treat it in childhood, and there rarely are problems in adulthood. But a lot of them need follow-up because they do have some risks of further problems. Other heart problems, you know that these children are going to need further operations or further procedures in childhood. And so they need follow-up for the rest of their life. So you may have to look for certain heart problems. There may be valves that will continue to leak. And they may need a valve operation, when they're 15, when they're 20, when they're 25. So you've got to actually monitor them, and at the right time, make sure that they get the operation. Others, we talked about rhythm problems. So you may have problems with electricity in the heart. When you operate on the heart, you can sometimes disrupt the normal pathways for the electrical signal to go through the heart. And then some of these patients may have increased, may be more prone to rhythm problems later on. You need to monitor for them, monitor these patients for these rhythm problems, and treat them. So a lot of patients have heart problems in the children, may be treated, but they remain patients, and we follow up these patients sometimes for 30, 40, 50, even longer. So I have some of patients who are in their 50s now, who have congenital heart disease that were treated and still need monitoring, and some of them need procedures later on.
A question that comes through, can the learned doctor give any advice to parents who have children with these heart conditions?
Yes, so I think it's very scary for a parent. A heart problem in particular, people see it as something that's life-threatening. You've got a heart problem, you see it as impending doom, or the child is not going to survive, or that sort of thing. The good thing is that most heart problems, not all, most heart problems are treatable today. And so most children can have a fairly normal life with a heart problem, depending on what it is. Again, we've got to accept what we've been given, and be grateful that in this day and age we can actually work out what the heart problem is in most patients, and in a significant number of patients be able to do something about it. If we were born 30 or 40 years ago, we wouldn't have that ability, and often children would have passed away and no one would have known what the cause was.
Another question that comes through, the listener asks is, can you also put in stents for children, or is this an adult thing?
So it depends where you're putting the stents. So stents for adults, the stents are mainly what we call the coronary arteries. So those are the small pipes that supply blood to the heart, and that's what gets blocked in adults. In children, that's not the case usually, and it would be because the blood vessels that supply the heart are smaller. It's extremely unusual to put a stent in the coronary artery in a child. However, they may put stents elsewhere. So for certain conditions, usually in older children again, because if you put a stent in a child, you must be sure that you can make sure that it grows with the child. So we do have conditions where you have, for example, narrowing of the pipe that supplies the blood to the body, called the aorta. So you get coarctation and narrowing of that pipe. And sometimes it can be managed surgically often, but in bigger children, you may put a stent. But of course, you have to make sure that that stent is big enough or can be later on enlarged so that it can enlarge to adult size. You don't want to put something in that you can't bring up to adult size, because it will become a problem later on. So generally, stents may be put in for certain conditions. They may be temporary. Sometimes you put in stents to what we call palliate. So you do it, maybe you can't fix the heart problem, at that stage. It's a newborn with certain heart problems. You may not want to be able to fix them at that stage, but you may do a procedure where you keep a pipe open with a stent until the child is bigger, and then you can hopefully do the full surgery for it. So under certain conditions, just to help the baby grow bigger, we may put stents, or other conditions we can treat with stents, provided, of course, that we can get we can make those stents bigger with time.
I was about to ask you if you're having fun. Because,
yeah.
because when you're having fun, you know what happens, time flies. So we've reached the end of the program, unfortunately. I want to thank you for joining us on the program, Dr. Ibrahim Hoosen. I'm sure you have a message for our listeners.
A message for our listeners. I didn't think about it. But what I would say is that if you get a diagnosis that your child has or may have a heart problem, there's no need to panic. Okay, a fair number of children get referred to us for heart problem. Often we find, number one, there's no heart problem. If there is a heart problem, it's often minor. Most heart problems, even if they're major and need some sort of intervention, for most of them, not all, most of them, there is some intervention that's available and that can be done.
Jazakallah khair, Dr. Ibrahim Hoosen, for joining me in the program. May Allah SWT reward you for your sacrifice and for having shared that knowledge with us. To the engineers in the various radio stations, thank you very much for having engineered this evening. And I want to thank all our listeners once again for joining us on Medical Files. Medical Files will be back with you next Tuesday, inshallah. So till then, for myself, Faizal MJ Suleman, do have a wonderful weekend. Assalamu alaikum wa rahmatullahi wa barakatuh.
حياتي وفيا لأجل هناء البشر أقول له أفلح الأوفياء وحسب الوفاء يطيل العمر هنيئا لمن أخلص الحب عمره وسحقا لذا